Hello, everyone. Thanks for joining us. Welcome to the latest in public health research. I'm Jen Ahern, Associate Dean for Research in the School of Public Health. And I am very excited to introduce our two speakers for today. And so our first speaker is Dr. Lori Dorfman, a professor in health and social behavior here at Berkeley Public Health, who focuses on how communications can best be used to improve population health by creating healthy, equitable environments for all residents. Dr. Dorfman also directs the Berkeley Media Studies Group project of the Public Health Institute, and I think she'll make some comments on sort of the work of that group and how that connects with what's being presented today. And then also presenting today is Hina Mahmood, who works as part of the Berkeley Media Studies Group as well, and did a lot of work engaging with the analyses presented as part of the research presentation today. So they'll be talking about news coverage of declarations of racism as a public health crisis. Before I hand it over to them, just a reminder for the students to check the chat and sign in on the sheet to show that you were here. And yeah, with that, I'll hand it over to Lori and Hina.
Jen, thanks so much. And we should also say that Hina got her MPH here at the School of Public Health. So we are very happy to be here to talk about research that we did in a while ago in 2020 that examined news coverage declarations of racism as a public health crisis. So we're going to tell you what that means, why we did it, what we do at Berkeley Media Studies Group, and I refer to the context that we're in now that discussing this research, and we'll be really eager for your questions. So now let's see the next slide. So this is just our disclosures. We have nothing to disclose, and to say thank you to our co-authors and the people we worked with primarily at the Praxis Institute and the CARE Collaborative. I want to start with this slide, which comes from part of the, oh, I'm hearing an echo. Should I do something? Let me know if I should. This slide is a picture from the website at the School of Public Health, Race and the Racism Harms Health is the URL, and Hannah will put it in the chat for you. And the reason I'm putting it up there is because it's a reminder. It's what prompted this study, and it's under attack right now. And in public health, one of the things that we rely on is not our whims about what's right and wrong, and we get motivated by what we see that's wrong with the world that we want to fix. But we move based on data, and the data that we collect that tells us what is it that can make a population's health better. So there have been data collected over many, many years that tell us a lot about why some people suffer more from health problems than others. We know, for example, that where you live can predict how long you live. And we know that where you live in our society has been structured by structural racism, in particular, redlining and other things that mean some places harm health and some places foster health. We know from tons of public health data that work can affect how long you live and how healthy you are. And we also know that structural racism shapes how those workplaces look. We know that systemic racism in policing has changed what oh, I suddenly see myself. I don't like to see that. Sorry, I have to change it. Oh, thank you, whoever did that. We know that structural racism embedded in policing has wreaked havoc on communities and fostered state violence, and that harms health. And these data are profound and robust. And in 2020, partly in the answer to what the nation was experiencing after George Floyd's murder and many other murders at the hands of police and the uprisings that happened around the globe, the School of Public Health examined itself and what it was doing and had its own program for being sure that structural racism was attended to and that we were doing what the public health data demanded we did in our own practice and how we were teaching and what we were learning and how we were moving forward to change the world to make it healthy for everyone. This website was part of that work. So it went up and it's still a work in progress. But if you go up there, you'll see the neighborhoods page, very robust, the work page, very robust. Education will soon be robust, thanks to faculty member Seth. And it's a place that anchors not only this study, but what we are doing in public health. And I think it's important that we continue to point to it and continue to remind people that public health operates out of the data. So we're not the only ones that saw this. Of course, people around the country were, by saw this, I mean understood the profound impact that racism has on health. And cities around the country were starting to make declarations, formal declarations in municipalities, counties, states, other places to say that racism is a public health crisis. So when we learned about that, we got very curious and we wanted to know how those declarations of racism as a public health crisis were appearing in news coverage. So in the next slide, what you see is that the reasons we care about news. So at Berkeley Media Studies Group, we study the news media. We're a public health group. Hannah got her MPH here. I got my degrees here as well. We have there's only about 12 of us, but about half of us, I think, have MPHs. And so we're a public health shop, but we're interested in news. And the reason we're interested in news is that if we, as you all know, when you first learn about public health, the thing you learn is that if you want to protect a population's health, not just any given individual one at a time like you might do in medicine, but a whole population, you have to pay attention to the conditions in which that population lives. And that's what we just talked about with how racism affects those conditions. So if you want to do that and you want to do something about it, you have to understand how those conditions get that way, who can change them, what needs to happen. And when you study that, you realize, well, in our day and age, it's policymakers, we're getting a big taste of that right now, who shape the conditions, the resources that people have. So if you want to have, as a public health person, if I want to have an influence on policymakers, then I need to understand where they get their information, how they might understand the issues I care about, and what the context of those issues might be, because for them, the news is going to be the starting point of their understanding. They pay attention to what's in the news. So if I want policymakers' attention, I have to pay attention to what they pay attention to. That's what brings us as public health people to an interest in the news. So we study the news so we can understand what the starting point of those conversations might be, what might be missing from the debate, what's there, and really what's not there in the news, if you know about the issue deeply. Then we take that and apply it to media advocacy training for advocates, organizers, public health practitioners, lots of folks that we work with. And we also work a little bit with journalists because they're sort of the other side of the question. And for us, we want to know from an epidemiological point of view or public health point of view, are they asking the right questions? So that's what we do at BMSG. So when the declarations were happening in the summer of 2020 and before then even, we wanted to know, how were they being portrayed in the news? Because that sets the agenda for what people think about and what they talk about, as we are getting a big taste of now. The news also shapes the debate by what it includes and what it excludes. And it affects decision makers and what they could do about it. If the news doesn't include solutions for public health problems, they're going to be less informed about them and it's going to be harder to convince them. So the key functions of the news inform what we do at BMSG, and they informed how we approach this project. So, and then what's the next slide? Hannah, bring me the next slide. And I'll try to speed up. So that brought us to these questions. We wanted to know, we knew the American Public Health Association had collected all the, and I should have put the link in the chat, I forgot about that. The APHA has a database where they've been collecting declarations for public health, racism as a public health crisis. So it's a pretty vast database, but it allowed us to see, well, where those things were coming up, which states, which municipalities. That would allow us to collect news coverage to see, were they covered? Were the things that were important about them covered? For example, did the coverage include whether or not public health departments, if they were the ones generating it, were engaged with community groups who cared about this issue, or were they separate? How was racism as a public health crisis characterized in the news? That's what we wanted to learn about. And was the anti-racism work that people were doing, was that portrayed as well? So we had a whole array of questions. And Hannah is going to take you through how we approached those questions and what we found out, and then we'll have some time at the end to talk about it.
Thank you, Lori. So Lori did a really great job of context setting for this research that we did. So what we did was we looked at the U.S. newspaper and wire services from January 1st, 2019 to December 31st, 2021. And we developed and refined a coding instrument on how media portrayed policies, government, community actors, and other issues. We did intercoder reliability testing to make sure that our coder alignment didn't occur by chance. And we assessed a nationally representative sample of 127 articles to see how declarations of racism as a public health crisis were characterized in the news. Just a little bit about our sampling. So we looked from July 2019 to December 2021, and there were over 3,000 articles. We had a proportional random sample of about 200 articles, but we really wanted to hone in on the articles that talked about specific policies or declarations around racism as a public health crisis. So we decided to exclude 73 articles that weren't really about that, and we landed on a substantive sample of 127 articles. So when we look at the news, we're really interested in, first of all, news hooks, like why is the story actually in the news? And often, and in our case, it was true as well, that most stories are in the news because of a milestone, which is essentially an event or a controversy. And because we were focused in on policies, most of them talked about the passing of a declaration or the process of passing a declaration. We had a few on anniversary seasonal pegs, which were more stories about, it's been 1 year since we passed the declaration. What progress have we been made? Does more need to happen? And then there were much smaller amounts of articles based on data, release of report, or a feature article. So this I thought was a really interesting slide. So we collected articles about racism as a public health crisis from Jan 1st, 2019 to the end of December. And as you can see from the chart, there were virtually no articles about this until about May, where there's a slight uptick, but really there was a huge coverage really skyrocketed in June of 2020. And in that month alone, there were over 800 articles on racism as a public health crisis. And that coincided with the murder of George Floyd and the Black Lives Matter movement. One thing that I wanted to also just talk about here is that recently ComShip released a report, and they looked at 5 years worth of data on how racism is spoken about in the news. And what they found was that from the summer of 2020 to the summer of 2021, structural racism really showed up, and there was a real emphasis on it in the news. But then in 2021 to 2023, there was a shift to criticize from structural racism to criticizing the critical race theory. And then the final frame that they looked at was DEI, which was the shift went from criticizing critical race theory to, DEI in 2023 and 2024. And in the beginning, there was a bit of positive news about it, but essentially the bulk of it was around attention to bans and other rollbacks or closures of DEI programs and hiring activities in state agencies and universities. And Lori will share that report in the chat as well. So it's just interesting to see how, and the structural racism part of it also aligns with our findings, which we'll talk about in another slide. But it's just interesting to note how things have shifted in the way we talk about racism. One of the things that we're particularly interested in is what are the issues that showed up in the news when we're talking about declarations of racism as a public health crisis. And usually we don't see racial disparities mentioned as much as they were, but here you can see that it's notable that over 40% of articles did mention it, and a lot of them had to do with health disparities, especially due to the COVID-19 pandemic, which really highlighted, things like healthcare access for certain populations was not there, and medical racism. There were many articles also on Black Lives Matter protests, which also led to the declarations, and then fewer on community engagement and police reform. But those were also topics that did come up. So here we have come back to sort of the ways that racism is spoken about in the news. And in our report, we found that, or in our research, we found that racism was described as systemic or structural in 43% of our articles. And it is encouraging to see this, but a big sort of caveat of that is that news coverage discussing health harms of structural racism were almost exclusively driven by policies that were passed in response to uprisings about police violence against Black people, and they really weren't in response to ongoing health inequities. So, one of the things that we should think about is if you do include terms like structural racism in mainstream media, it is important because it really brings the concept to a wider audience, like public health practitioners and advocates, and it does generate news coverage, but we need to find a way to generate news coverage that doesn't rely on, these horrific events. What Lori had mentioned in the beginning was that narratives are also framed by what is there and what isn't there. And what we look at, one of the ways to sort of see that is how who speaks in the media or who is quoted. And what we found was government officials were on almost all of the articles and almost in over 90% of the articles. A lot of them were health departments or local or state officials. We did have community members, but quoted in some articles, but they were less than a quarter of articles. And so their voices were really missing from the news coverage. One example I just wanted to give of what it could look like, but it was really rare, was Vanessa Monique from Bridgeport, Connecticut. She was pressing lawmakers to pass legislation declaring racism as a public health crisis when they were creating a state commission on racial equity in public health. And she said, quote, "As a Black woman, I personally experience the effect of systemic racism daily, but for the low-income public housing community, it is greater because there are multiple systems that weigh in on their lives." So, it would have been much better if we could have seen more quotes from the community. We also wanted to see other ways that community was portrayed in the media, and what we found was that there were some articles about community members calling for change. So that sort of showed up in people going to city councils, pushing for declarations to be passed, or maybe attending a protest. But they rarely were shown to be part of a process of developing or implementing specific declarations. So in summary, our main points were that coverage really peaked dramatically after the murder of George Floyd and countless others by police. Most stories were centered around the Black Lives Matter movement or were due to health disparities due to COVID, which brought health disparities to the forefront. Community voices were seldom included, and they were rarely shown as being part of the process of instituting the declarations. And finally, the term structural racism appeared most often in response to uprising about police violence against Black people. Okay. Thank you.
Oh, any questions? People any thoughts?
Thank you so much, Lori and Hina. That was really fascinating. And thanks for all the links in the chat as well. Yeah, please, if people want to ask questions or have comments, feel free to put them in the chat or raise your hand, and feel free to put your cameras on if you'd like.
Oh, this reminds me of teaching in 2020 when everybody had their cameras off and nobody wanted to raise their hand. We had our ways then. Monique, you have a question, I know. No.
I just made a note in the chat. No questions, just kudos.
Okay.
I've been in Lori's class and my dissertation was on police violence against Black women. So I'm just taking in the information. Thank you so much. It was excellent.
Yeah, Monique, you should look at the policing page on the Racism Harms Health website. And somebody else from the class did a lot of the writing on that. A later class than yours, Michaela Taylor, but she did a really nice job.
Oh, already made a note. Yes.
Okay.
Thank you so much.
Okay.
I'll ask a question while others are gathering their thoughts. I'm curious why you think community voices were not represented, and what, I don't know, that feels like worth understanding, and what could be done to maybe, I don't know if it's that the people covering things would need to understand that that would be important, or yeah, like sort of what's the action from that finding?
Yeah. It's a good question, Jen. I mean, when we conceived the study, we did this in partnership with the Praxis Project. And the Praxis Project is an organizing project that works on a variety of issues. Some of you might know the founder, Makani Temba, and the current CEO is Javier Morales, who is very active in the local Berkeley soda tax campaign and is really adept at helping communities engage with policy and raise their voices, which happened in the Berkeley soda tax campaign in a really dramatic way. And so when we first got together and started talking about the idea, what they were interested in was exactly that question. When the ordinances or the declarations were created, were they instigated by people in the community? Were they instigated by people in public health who went to the community? What were their collaborations? And there was a little bit of that, but so our research initially had and included surveying health departments and other places that had the declarations to find out the answer to that question, and community groups. And the Praxis Project convened learning circles so we could dive in deeper. And I put that report in the chat earlier. I can repost it. It was, maybe because of COVID, maybe just because it's hard to get people working in public health to answer surveys. It was really hard to collect the data. So we found a little bit of evidence of that, but not really enough to publish about, to go to town on. And I think that our feeling and their feeling is that none of this is going to be lip service. It's going to be words if there's no action attached to it. I mean, that was sort of our hypothesis going in. We were even thinking, wow, we wanted to analyze the declarations themselves to find out, did they have more teeth in places where community had been engaged, but we just couldn't find enough data there. And I think people were just overwhelmed in the health departments with what was going on in COVID to sort of respond to a survey about even racism as a public health crisis. And so we just didn't get enough data to answer that question, unfortunately. The people who did respond did have a lot to say about the importance of the community engagement process and what that could bring. And so you'll find that in the report. So, but it's a good question. Monique, go ahead.
Well, I did have a question about the articles. I think, I don't remember which one of you said this, but, wouldn't it be great if we could have these articles without a central catastrophic event? And my question was, the better articles, how are they able, because, as I learned and have observed, but learned from you, that you love the personal story. But the
Right.
personal story doesn't address the systemic. The better articles, how were they able to resist that impulse? Or how were they able to create a story about a systemic issue that was effective and help the journalists move away from the single story?
Yeah, I think that's really, really tough. Hannah, do you want to answer that before I jump in, or?
No, I'm going to leave it to you, Lori.
Okay. So yeah, that's the question we've been working 30 years on, Monique. So it's not easy. And it's challenging, and it takes on its own shape in every issue. And the thing I put in the chat is research not related to this project, but other research we've done that it was also done partly in response to what was going on with COVID, when public health was under attack in many states, where state legislatures were trying to take away public health authority. It's what we're seeing now happening at the federal level. So the thing I put in the chat was research that we've done about how to champion public health, how to talk about it in plain terms and help people understand what it means, and use metaphors to help people understand kind of make visible what's invisible. Public health, when it's doing its work well, is behind the scenes, invisible, but other parts of infrastructure are kind of visible. And so the analogy became the fire department, right? You don't take away the budget from the fire department during a five-alarm fire, right? So that was sort of the COVID analogy. So I put that in the chat. In relation to this study and to racism as a public health crisis, we're in a serious deficit here. We all know, like I started with the data, what the problem is, how long the problem's been going on, and what it's connected to. It's complicated to talk about, and we need to talk about it in plain language. And part of that was the impetus behind that website as well, was to talk about the structural racism in plain language so people could understand. But for something to get in the news, there has to be a news hook. Something has to happen. And unfortunately, controversy is the most common news hook. So that makes it harder to tell stories about community, about stories where people are taking action that is making a difference. There's a whole movement in journalism that has been fostered by a group called the Solutions Journalism Network, where they are journalists talking to other journalists saying, hey, if what we do as journalists is investigate, why don't we investigate solutions and not just investigate problems? So there's the journalism side of things where they could be doing things better, and they do need to be watchdogging what local officials are doing and how our money is being spent and all that. So there's that whole bucket of stuff. But from our side, if what we want is people to understand this problem of racism as a public health crisis, we have to create news about it. And that news has to be different and better, and not a Black man getting killed by police. That can't be the only thing that brings this to the fore, or we're going to consistently be in this problem. Now, there have been people who have taken the lead to shift the way this nation tries to think about racism, which the ComShip group, we call it ComShip, it's the Community Media and Messaging for Health and Social Policy. I don't know, got that wrong. That was also in the chat, but they're out of Minnesota, University of Minnesota, Cornell, and Wellesley, and colleagues of ours, we have worked with them on studies as well. And they're the ones who said, okay, in 2020, right, structural racism did appear. People in our shop were pretty excited that the words structural racism we were able to find so many times in the news. You saw that, the chart, that was pretty good. But the impetus for that wasn't good because it was the violent act. So now people have responded to that with an anti-public health frame that first challenged and attacked critical race theory, not understanding what it was and using it as code for Black, in my opinion. And that has moved on now to anti-DEI, which again is code for Black, in my opinion. And that is a way of harnessing fear and dividing people, when in fact we have way more in common with each other and with our goals in public health than what that narrative is portraying. So that means it's incumbent upon us to create news about other things. That's why we have to not just publish in the academic literature, but we have to talk about it elsewhere. We have to put out our blogs, we have to do our podcasts and Substacks, and we have to have opportunities to create news where we can talk about what the problem is, but also what people are doing to solve it. Because that's what draws people to understand and feel more empathy, but also the way that we might solve problems together, which gets at what you were talking about, getting to what we call the landscape as opposed to just the portrait. You know me, I could go on. I'm going to stop, but I don't know if I got all the way to the answer there, but. I know y'all have questions. Lauren, do they have to write a paper for their 1 unit or they just have to listen? Oh, see, well, there you go.
Well, I know that folks, come on, ask some questions. I will ask, what are you working on now? And is any of it connected with some of the federal things that are occurring, or might it be in the future? Because it seems like a really interesting time to try to understand what is happening in the media, particularly since it seems like we maybe have, sort of separate media rooms that different parts of the country are in, and not maybe in each other, watching each other's sources. And
yeah. And Jillian has a question in the chat, I see. And Hannah, I don't think we did that analysis on this particular thing, but you could look at that. Jen, we're working on a variety of issues. We just published a big deep dive into park and green space equity, how to bring equity to the fore in those kinds of conversations so that people understand the connection between public health, racial justice, and having not just access to parks and green space, but also participation in the decisions about where our resources are going for parks and green space. We just published another big deep dive into gun violence and firearm suicide and how you can talk about that effectively and in a variety of different contexts. And we are, yes, working with health departments who are completely under siege right now and are very worried about how they go about their work. And we have groups who, for example, in counties in California where anti-health forces have taken over the board of supervisors and have fired health officers, have forbidden people to use the word equity. So we get questions like, how do we continue to talk about health equity without using that word? Because people are fearful about it. And on the one hand, there's a lot of controversy about that. People don't want to cede that space, right? And something we have fought hard for, to say, no, this isn't about just differences and disparities. This is about what is equitable in our society and the society we want to create. At the same time, nobody knows what equity means outside walls of public health. And so it becomes very important to be tangible, direct, and clear about what we mean when we're talking about the conditions in which people live, and that everybody in a community ought to have place to walk, a school that is serving their kids, a job that pays the bills so they don't have to have two jobs. We can talk about equity using tangible terms. And so that's one thing that we're doing. We're also really looking at some of the research coming out of a variety of groups that we work closely with. We're fortunate to be part of a project that the Robert Wood Johnson Foundation is funding for people to come together. There's about 6 groups that have come together: Frameworks Institute, Race Forward, Narrative Initiative, Berkeley Media Studies Group, a couple others. And we are working on trying to get even deeper in understanding the question Monique raised, which is how do you counter the mindset of deservingness and help people understand what the environment needs to be if we are all going to thrive together, and what it means to talk about that. And Frameworks in particular has come up with, has done a lot of research that shows that sort of no matter where you are on the political spectrum, you think the system is rigged and it's rigged against you. And that's a terrible place to start when we in public health have to be able to talk about the good government can do, because government is how we get to scale. It's how we get equity to everybody. Foundations aren't going to do it. They're a drop in the bucket. Government is where we pool our resources to make sure that people have what they need in order to be healthy. But government has never been more demonized. And we've got a situation right now where, sure, government needs to be fixed, but you don't fix it by taking away Medicaid, throwing seniors out on the cold so that billionaires can line their pockets. So we have to talk about that explicitly. We have to explain to people that when the system is rigged, we can fix that, but we have to understand who's doing it and how they're doing it. And when we explain it, what their research shows is that, again, if you explain it in tangible terms, what it means when programs are taken away, and don't even use the terms programs, but use the actual things that are happening when you're taking food out of people's mouths, which sounds like hyperbole, but is literal, then people have a better understanding of what's going on. So we're working on a whole panoply of issues that definitely sometimes keep us up at night. And I don't know if other questions came up in the chat because I can't talk and look at the same time. Molly, you know, I'll call on you because I know your name.
Okay, I'll ask a question.
There you go.
What are some of the values that you think are really important during this time that can align people with these different political ideologies and thoughts that they think should happen? I'm thinking like our level 1 values.
Yes, level 1. So what Molly's talking about are, it's a term we learned from a cognitive linguist, George Lakoff, who helped us understand that people don't connect to data, people connect to values and emotions. So in public health, we're really good at throwing up the data and showing these disparities and putting our hands on our hip and saying, can you believe that? And we're putting them up there because we know those data represent inequities in the conditions that have made populations sicker. When people don't have that background and we just put up the data, they look at that and say, well, I mean, people live 10 years less if they live in this neighborhood than that neighborhood. Why don't they move? So it doesn't occur to people that there are conditions that make a difference in individuals, and they don't connect to it unless we name the values that brought us to public health in the first place. We could have been doing a lot of different things. None of you on this webinar today, I don't think, are in the business school. Not that there's anything wrong with being in the business school or the law school. You're here because you have a belief that when we work together and when we come together, we uphold each other and we create the world where all of us can thrive. That's a value of interconnection, and that's a value actually, Molly, of aspiration. It's the future that we want to see. And in a time when so much fear and division has been fomented, that it's so easy to trigger. I mean, it's hard to even look at my blue sky feed or my or the newspaper because it triggers so much of that fear and anger and divisiveness. But we have to look away from that and look ahead to the world that we want to create. Because when we talk about that, that's what people connect to. People want a better world. They want a better world for their children. They don't want to be in fear. And so what we have to help people understand is that the policies and the conditions that we've been studying and we want to put in place are the pathway to that world because they've been contributed to by the communities that we're working with. People have said what they need and they want. We've taken the data that we've learned in public health and applied it to that and made our best guess of what the next best thing is to get us to that place where we can all thrive, no matter what the color of our skin is or what's in our wallets, that we all have a place that we can call home, that we can feed each other, feed our families, that we can take care of each other. And it sounds syrupy sometimes to say that, and we don't say it often among ourselves because we walked in the door with those ideas and now we're trying to figure out, biostatistics. So we're focused on what we're doing, but we have to remind ourselves why we do that. And it needs to be out of our mouths right at the top of whatever we're going to say in whatever context, because then when we do that, all the things that follow are understood in that umbrella and people understand them differently than if we just start with the data. So depending on the issue that you care about, if it is climate change and getting rid of concentrated animal feeding lots, then you talk about what it means to live in a community that doesn't have to have that place nobody wants to go and is changing the economy of a county when everybody could thrive if the local farmers were supported differently. And you do that in whatever issue you're walking into. You knew that already, though. You could have given that answer, Molly. Yes, you could.
Need to be reminded in times like these. So thank you.
We all do. We all do.
Yeah, thank you so much. I think that's a really important reminder for everyone to think about. I'm curious about how you think about framing language for grant proposals given so much uncertainty and where you think there'll be some common ground that won't be frowned upon at the federal agencies, or if you have any thoughts about that.
Oh, you mean federal grants?
Yeah, that's a lot of what I work on with our faculty are our federal grants.
Right. Lauren, I am not a good person to ask that question. We don't have a lot of federal grants. That's, good and bad over the years. We have depended primarily on foundations and a little bit of fee-for-service work. So we've worked on federal grants, but usually brought in by like as a co-PI kind of deal. So I can't give you do this, do that. The thing I will say though is that, and I think this is true across public health, is that we have to be true to our data. We have to tell people what the data say and what the data dictate that we do next and what questions the data raise that we need to investigate more. And I think we can't let go of that, and we have to be secure in that. I think that's what motivated those of us who worked on the Racism Harms Health site to want to make that data available, easy, in plain language, so people would feel confident standing up and saying it. I think it's time to double down on that. Everything is very unpredictable right now, but I think presidential ratings are plummeting. People are upset. I don't know if you've seen some of the town halls that have gone viral where people have been screaming at their Congress people. So I think we have to make our voices louder, be connected to the people who are trying to make change, and to bring the secret sauce that public health has, which is a historical understanding of what the social change and initiatives. I mean, just think about clean water. Think John Snow taking the handle off the Broad Street pump. Think about this legacy we have of thinking not just about ourselves or our individual families, but about what it means to be healthy as a community together and what we've investigated together, and to repeat it and bring it forward.
Thank you. Thank you so much. Any other questions? Thanks, Monique. Great. Well, thank you so much. And Lori, we really appreciate your time today and sharing this important work. And I can share some of the links with everyone afterwards as well. And we'll have the recording available too. So thank you so much. And
Thank you, Lauren. Thank you all for being here.
Y'all have a good day. Thanks so much.
Thank you.
Bye-bye.
Bye.